So very excited. We have a lovely young lady. She's a beautiful 31-year-old female who looks great, but still, you know what happens. The prettier you are, the more you want. The uglier you are, the less you want. So I am okay with my broken nose. See this? Yes. No, I'm not okay. I'm gonna get it done one day. I promise you, if I can find time. But anyway, it's not about me. It's about our lovely lady. So she is from upstate New York, and she had rhinoplasty done, and it looks good. I saw the results. It was done 2 years ago. Then she wanted to narrow the nostrils. She went back to the same surgeon, but he didn't feel comfortable doing narrowing of the alar area. He just did the nasal cells and didn't do enough. He did a good job what he could do because everybody's got their own niche. So she wants me to now narrow the alar area and do the alarplasty, and I'm very excited to do it for her. So let's take a look. We'll take some pictures, video, and hopefully more people can see it, and then if they need help, they can find someone who can do it for them. So we are looking at the beautiful nose. Looks great, but if you see, I'm going to have the patient smile now. So go ahead. Today's the happy day. So there we go. So you can see the flare and the widening that happens. It might not look bad in person, but sometimes on the picture looks not good. And that's a big complaint that I hear. And you can see that the alar grooves are fine. They are untouched. And as you come to the nasal sill, right there, that sensation is a little depressed, but I'll try to see if I can evert it and make it look nicer as well, because both sides are depressed. We don't have much sill, so we don't want to, do anything to the sill, and extend only into the alar groove area. And that's what we'll do. So let's get going. She came all the way from upstate New York, so we have to do a good job. So we have done the markings. As you can see, we did not remove anything from the sill. Stop right there. That's what we did. Now, here from the old scarring, there's some scars and this depressed. So hoping to evert a little. This side is almost a web. I'm going to shine the light so you can see it right there. That scar is causing a little webbing, but it almost looks like a natural cell, so we can leave it alone. And trying not to violate the sill area. That's the goal. And just reducing the flare, and that will be it. Let's get started. Okay, so we have finished with the left side, and let's take a look. So as you can see right here, we have closed very nicely. Deep sutures are 5/0 PDS. This is 5/0 plane, and we did not enter the sill. Stop right here, and the flare is gone. So if you compare the left to the right, you can see how much difference there is. And now we'll replicate this on this side, and we should be done. So we are done. So tell me, how was it?
Well, I was asleep.
You were asleep. Any pain, any anxiety,
No.
any issues?
None.
Okay, and have you had a chance to look at it?
Yes.
Okay, and what do you think?
It's gorgeous.
Oh, you are gorgeous. That's why.
Thank you.
You're very welcome. Great. So hopefully, will you be coming back or no? Because you're far.
You're right.
So that's okay. Just do me a favor, keep like a video log whenever you can, and some pictures of the progress, and then you can send them to me so I can post them on YouTube as a follow-up. Because that's the biggest thing. My patients come from far away, and then I don't get follow-ups.
Right.
And everybody says like, well, you do a lot of this, but I don't see any after pictures.
Right.
And I'm like, okay, so hopefully you will.
Oh, definitely for you.
Great.
Absolutely.